Hello. Today we'll talk about hormone replacement therapy, that is in postmenopausal women. What is the basis of hormone replacement therapy? In menopause, there is most of the symptoms. You can understand the most of symptoms are due to decreased estrogen level. Okay, so we need a postmenopausal hormone replacement therapy. What are the indications of hormone replacement therapy? The postmenopausal hormone replacement therapy, if there will be if severe hot flashes, if suppose the patient has primary ovarian insufficiency, that is premature ovarian insufficiency, suppose they have a prematurely they have a stop phase of menses, that is called primary ovarian insufficiency. Then individual with decreased estrogen level, where the conditions where we can get a decreased estrogen level, like you can see the patients those having Turner syndromes, and those patients having Swyer syndromes and androgen insensitive syndromes. Okay, and suppose the patient has underwent a surgical oophorectomy, suppose so she had operated for any oophorectomy, like ovary has been removed for any ovarian malignant ovarian tumors or ovarian cyst or any dormant cyst, any procedure that has been removed, surgically remove the oophorectomy. So basically these are the indications we have to give in these cases, like post-menopausal hormone replacement therapy. If there is severe hot flashes, is there a primary ovarian insufficiency, can give in those patients decreased estrogen, like barrier syndrome, like Turner syndrome, Swyer syndrome, androgen insensitive syndrome, and if the patient is operated for surgical oophorectomies. Okay, then what are the types of hormone replacement therapy? You have two options. One is estrogen only. What are the types? In types, you have estrogen only HRT and estrogen plus progesterone only HRT. When you will give, if you are suppose if you have a uterus, if uterus is absent, there is no need of progesterone, because estrogen, you can give estrogen only therapy. Because if uterus is present, there will be, if you give only estrogen, there will be chances of endometrial cancer because of on opposed progesterone actions. So you have to give on opposed estrogen actions, there will be endometrial hypertension, there is no progesterone. So if it is present, uterus is there, then you have to give E plus P therapy, that is E plus P only HRT. What are the mechanism actions of HRT, hormone replacement therapy? Mechanism action, it will decrease the hot flashes first and foremost. Then second is protect endometrium from development of endometrial cancers. Then third is okay, these are the mechanism actions. Then how much duration you should have give for a in for HRT, hormone replacement therapy? So in a cycle, if it is a menstrual if it in a cycle, you have to at least minimum days to prevent endometrial CA is 12 days in a cycles. Ideal durations is as long as estrogen can give in, you can continue ideal durations. So estrogen only HRT versus estrogen plus progesterone only HRT, what are the advantages and what are the disadvantages? Each you can see. Estrogen only HRT, there is advantages: decrease hot flashes, decrease osteoporosis, decrease chances of colorectal cancer. Very very important. This very important point is colorectal cancer. Decrease the colorectal cancer. The estrogen only HRT. Then hot flash, estrogen progesterone also the same actions, the mechanism is also same, that is this also has a decreased hot flashes, decreased osteoporosis, decreased chances of colorectal cancers, decreased chances of endometrial CA. But disadvantage, very important, the estrogen plus progesterone pill, because here the progesterone component is there, so it has the extra advantages, it can decrease the endometrial cancers. Okay, then disadvantage of estrogen only pill, it is increased venous thromboembolism, because it has estrogen had a thrombotic property. So Lois with the, but if you give a transdermal route, suppose if you give a transdermal route, then it has the less chances compared to a IV estrogen or oral estrogen. And estrogen only, if you giving only HRT, if there is an uterus, then it will increase risk of endometrial cancer if uterus is present. It also increase the risk of ovarian cancer if you give him more than 5 years hormone replacement therapy. But remember, OCPL doesn't have any effect on the ovarian cancer and endometrial cancer. It has an effect on the cervical cancer. Okay, basically the adenocarcinoma. Then what are the disadvantages of the estrogen plus progesterone? The same as it is also increased venous thromboembolism. But estrogen plus progesterone also increase ovarian cancer plus minus, and it very important. It is endometrial breast cancer is plus P, because breast cancer is progesterone receptor. The factor associated, what are the factors you should look into before going to HRT? So you should not give the remember, it should not protect against any coronary artery disease, but if it is increase the risk if female is more than 60 years. It will increases the risk if more than 60 years. So before 60 years you can give HRT. After that it is a very controversial topics, you should not give because it doesn't protect against coronary disease, but it will increase the risk of female more than 60 years risk of coronary. Does not risk remember another things, it does not increase the risk of cervical cancers also. Remember, very very important. But ocipil has the risk of increased cervical cancer. Then what are the what are the drugs, the roots and what are the type of most commonly used HRT? The drug's name is 17 beta estradiol. That is the drug of choice. You can use 17 beta estradiol. The root basically you have to give transdermal is more commonly used because it will decrease the risk of thrombosis. Dose is oral route 1 milligram per day, started at 0.5 mg per day. The transdermal is 0. Very very low dose, 0.05 mg per day, started at 0.025 mg per day. The another is conjugate equine estrogen you can provide. Progesterone, the estrogen component is over. Now progesterone, there is micronized progesterone. Oral route is the drug of choice. Dose you can give micronized progesterone 100 to 200 milligram per day. The second drug of choice is the dydrogesterone. The duration of therapy, minimum 5 years you can give, maximum 5 years. It has to be given less than 60 years. And suppose they have a already decreased estrogen condition, already told the primary ovarian insufficiency, Turner syndromes, Swyer syndromes, you have to give up to menopausal stage. That is usually the natural menopause. These patients they have to require the estrogen till their natural menopause happen. So up to the natural menopause you can give for these patients. What are the contraindication in those? What are the cases we want to give HRT, that is hormone replacement therapy after the post menopause? Suppose they have a history of DVT, deep vein thrombosis, stroke, or coronary artery disease, because it does not decrease the risk, but decrease the risk of coronary artery disease, but it will increase the risk. Doesn't prevent, but it is increase the risk. If history of breast cancer, it is because HRT has an increased risk of breast cancers in E plus P therapy, so it should not give. Contrary, history of undiagnosed vaginal bleeding, endometrial cancers has to be ruled out before you giving HRT. Then a history of acute liver dysfunctions, because progesterone has a liver damage, liver derangement, STLT, liver enzyme hallucination disease. If it is hypertriglyceridemia, absolute contraindication. If it is hypertriglyceridemia, should not give. If there is severe uncontrolled hypertension, should not give. Okay, very very important things. The important points you are given to remember. So very very important, it doesn't have any contraceptive benefit. So if you want to give a, suppose the patient is premenopausal is, that is, suppose this the patients are like primary ovarian insufficiency, Turner syndrome, if they want also contraceptive benefit, in that cases you can give estrogen plus Mirena insertion. Mirena also had progesterone, so it will protect both endometrial CA, and it also has contraceptive benefit in the premenopausal women with hot flashes. What are the indications? Indication is less than 60 years, less than 10 years since onset of menopause you can give. Hot flashes contraindicated. It's a dog of choice. If suppose hot flashes is there and if it is contraindicated, HRT is contraindicated, then you should give flow existing in the dog of choice. The indication of E plus P HRT in a female with, suppose they have an absent uterus, with suppose they have a history of hysterectomy or endometrial CA for endometriosis, endometrial tumor of the ovary, supracervical subtotal hysterectomy. These are the indication of E plus P therapy. Suppose they have a history of hysterectomy due to endometrial CA, you should not indication E plus P therapy has to be given, because here uterus is not there, still you have to give E plus P therapy because there is a risk of endometrial CA, because there are estrogenic high risk of estrogen hyperplasia. So you should give again E plus P therapy. Those also absent uterus, history of hysterectomy due to endometrial CA, endometriosis, because endometriosis is there because estrogen has a hyperproliferative property, so it should give E plus P in those patients with the endometrial CA. Hysterectomy has been done for endometrial CA, endometriosis, endometrioid tumor of ovary, supra cervical subtotal hysterectomy. Okay, thank you.